people don't really discuss about this.
Most patients will say, I am stressed out, I am working 9 to 9, and this is so much stress, I am in front of the computer.
Today's lifestyle is very, very hectic, and especially most women these days work in the tech, and there's very little life work balance, right? So if somebody had to change one or two things in their lifestyle to manage PCOS, what are the safest methods that you recommend?
Whether you're 25 and thinking about freezing your eggs, 30 and struggling with PCOS, or 35 and wondering if it's too late, this episode could change the trajectory of your health and family planning.
So is it safe to use a oral contraceptive for really long term, for 10 years, 15 years?
Yeah, it is definitely fine. 70% villages in our country, balance 30 city patients, 4% maybe software. Plan. Rest, do not plan pregnancy. The best age to conceive is 22 to 29. See, PCO you have to treat. There is no other option. If you treat PCO, there are definitely very good results.
In today's episode, we break that silence from misunderstood pain during menstruation to the real impact of lifestyle on fertility. This is the episode that tells you what Google can't. You don't want to regret missing this episode.
If you're enjoying Decoding with Jaslin, please consider subscribing to the channel. It makes a huge difference in helping us to bring you the kind of guests that you would like to see. We would also love to hear your opinions in terms of the topics and content you would be interested. So please drop in your comments to share your feedback. Thank you for giving us your time. Hi everyone, welcome to another episode of Decoding with Jaslin. Today's episode is especially close to my heart as I'm joined by a woman who just isn't an incredible and respected gynecologist and obstetrician. She also happened to be the one who brought my baby into the world. So this is personal. Dr. Teena Thomas is a senior specialist in obstetrics and gynecology with over 2 decades of experience. And over the years, she's been a guide to countless women navigating everything from menstrual health, pregnancy, and postpartum recovery. Today, she's here to answer the questions we often hesitate to ask, but really need to know. Whether you're planning a family, managing PCOS, exploring egg freezing, or simply trying to understand your own body or your spouse's body, this conversation is going to be filled with clarity, empathy, and actionable insights for all of you. Dr. Tina, welcome to the show. It's truly great to have you here.
Thank you.
Okay, so I think we'll just jump right in, right? I think one of the things that a lot of people speak about is menstrual health. I think that's the core part of any women's health issues, right? Now, with today's world, stress has become such a common part. Irregular periods have become such a common part of everybody's day to day. But what would you say would be three things that are definite warning signs which say that you have to go to the doctor and just can't take it as stress and something, usual?
So basically, three main things which you see in menstrual. One is intermenstrual bleed. So between periods, if there is any amount of spotting or bleeding, any time between the months, then definitely you have to see the gynecologist to see what is actually happening. It can be a local problem or it can be a hormonal issue, but definitely needs a follow up. The second problem is frequent periods. So 28 days plus minus 7 days is a normal cycle. Any period coming more frequently, less than 21 days, so every 15 days, 18 days, that is not normal and should not be thought of as. So sometimes if the periods are delayed, like a 10 days delay, 5 days delay, unless there is no pregnancy, you are fine with it. There's nothing much to be worried about. But in case the periods are coming early and there are frequent periods, then definitely this needs to be addressed and looked on into. And the third problem which we patients look around is any excessive bleeding. So four pads fully soaked in blood can be taken as normal per day, but beyond that anything is abnormal. So any excessive bleeding with clots or persisting for longer number of days has to be followed up.
Got it. Now, the other very, very common thing that is going on right now is PCOS or PCOD, right? Very basic question. Is there a difference between PCOS and PCOD?
PCOD, PCO is polycystic ovary Okay, when it is causing period problems, it can be PCOD. That's a disease due to polycystic ovaries. So that is PCOD. When it is associated with other factors causing lot of obesity, facial hair, acne, including other infertility, fertility issues, hypertension, diabetes, that is a whole lot of syndrome coming in. So that is a PCOS, that is polycystic ovarian syndrome.
Okay, so if somebody has only PCOD, that means it's not something that needs to be worried about. It's PCOS. Is that right?
No, both of the things, both of thing is almost similar. Where multiple parts are involved, it is syndrome. Where only the reproductive system is involved, it's a disease. So both is a part of the same phenomena.
All right. And what are like the key symptoms for PCOS other than irregular periods, I guess?
So first thing, though it says PCOD or PCOS, PCO is actually not a disease. Okay, it's a condition that a person is born with usually. So when you are born with a PCO gene, then you have PCO. It is only that it is shown up at different points of life. So it is a lifestyle induced phenomena which shows up. So, a condition where sometimes it shows up as early as 15 years, or it may show up at 25, 30 years, or 35 years. So, depends on your lifestyle. So, you are carrying the gene, but because the lifestyle has been good, it never caused any problem to you. And at a certain age, when your lifestyle changes, that is when it starts showing up. That is PCO. So, there are multiple follicles for a normal person on the day one of period. There are 4 5 follicles or bubbles which form up, and from that mostly one will grow up to form a mature follicle which releases the egg. In PCO, on day one of period, instead of 4 5 follicles or bubbles, there are almost 20 of them, 18 to 20 bubbles. So they look like a bunch of grapes. So there is no cyst there. So it's a misnomer. There is no cyst there. But the 18 to for 20 follicles which are there look like a bunch of grapes, and hence they are called polycystic ovaries. Now, polycystic ovaries will show up more when the lifestyle goes bad. Till the lifestyle is good, should be fine. What it causes? It causes number one, irregular periods. Number two, increased facial hair. Number three, it may cause acne, but not everybody will have. 50% may have acne. Number four, it causes fertility issues. As age goes by, early hypertension, early diabetes, cholesterol, uterine bleeding problems are some of the symptoms and signs of PCO.
So you mentioned it's a lifestyle induced disease, right? So you also know that today's lifestyle is very, very hectic, and it's especially most women these days work in the tech area, and it becomes, there's very little life work balance, right? So if somebody had to change one or two things in their lifestyle to manage PCOS, what would be the things that would have the highest impact?
The most important thing is lifestyle. So, lifestyle includes a good diet, a balanced diet with high protein and good level of exercise in a week, and maintaining your ideal weight. Now, these are the three basic things which you need, not for PCO alone, for everything in life, basically. Right? Now, as you said that, see, what I feel as a person is that stress was part of life always. Okay, there are different ways that people had stress from probably your mother's time. They were locked up in the house with 7 8 kids. Do you think that was not stressing out them? Yeah, that was even more stressing than seeing a world outside and living your life. So stress was there at that point of time. But but we all grew up. I don't know, from after my generation, from till my generation, I have a feeling that we all grew up with stress as part of life. So we did not think as stress as a different entity. For us also, we had to get first rank in the class, we had to get 99.9%. If we didn't get, a neighbor's child got, we also got through go through all that anxiety and all that troubles. Everywhere we had to show up very good. You had to dance also, you had to cook also, you had to sew also. I have personally attended tailoring classes. So you need to be a good tailor, you need to cook, you need to dance, you need to sing, you need to study, and you need to clear the entrance. So stress was there at that time also. What I feel today is, today people are not able to take that part of stress more. Okay, because they think is whatever happens extra than sleeping, eating, drinking is stress. If that is stress, then everybody has it. So most patients will say, I am stressed out, I am working 9 to 9, and this is so much stress, I am in front of the computer, this is stress. So I ask them, after you have a child, are you going to stop working? So the patient says no. Then when you are going to work lifelong and you take it as a stress, how does it work? It doesn't work. So basically, it is selling. Stress is selling now. Okay, so that is why it people stress is pinched on so much. But driving 60 kilometer daily, if you think is not stress, I do that daily. So if that is not, but I don't take it as stress. I enjoy the every minute of drive I do. So it is how we take stress. So point is, as I told, for everybody, beyond eating, drinking, and making merry, everything is stressful. So we have to take what is stress and what is not stress in our life. If we do that correctly, half the problems are solved. So the question was that how do we manage these things, is the most important thing is how to manage your stress. Everybody has 24 hours. So if you know how to manage those problems in that 24 hours, you manage stress. Everybody, there are, all the people are going through different problems in life. Everybody is in a boat in a sea. There is nobody on the shore. So it's how you drive your boat works the best. So PCO again, you have to drive your life, right? So cut down on the stress, have a good lifestyle. There is diet and exercise and all part of lifestyle. It is not that you can't cheat any day at any point of time. You can't eat this. You can eat everything. It's just that manage, learn to manage things a little better.
That's such a good piece of advice, I think. You are right, stress is highly commercialized right now, and probably why, more and more people are also buying into the idea. And yes, in its own way, like you rightly pointed, I think the generation before us, they didn't have cars. I've heard my grandmother say that, if somebody fell sick, she had to carry that kid for I don't know how many kilometers and walk, right? To take even the child to the hospital. So, of course, when you think about that, yes, our life has become more comfortable, and probably we have become spoiled in that anything, like you said, outside of the standard comfort zone seems like stress to us. Now, if we get into management of our own body, choices of our body, right? So I want to get into contraception before I get into pregnancy and those parts of it, right? Now, contraception, first of all, I feel like it almost has a negative connotation in our society, especially for women. And they they feel there is a little bit of hesitation in discussing contraception openly publicly. People don't really discuss about this, even though I think everybody plans for their kids and for not having kids or whatever, but nobody speaks about this openly. So there is very less reliable information out there. Now, according to you, right, what are the top 2 or 3 most reliable and safest methods that you recommend for choosing a birth control from both, say, a health perspective and also like life planning?
Contraception, very important part of life, and now it is even more with all women working round the clock. So either they are working in the office or at home with the children, with the family. So, and hence contraception plays a very important role. Now there are many methods of contraception available, with like barrier methods, which include condoms and oral contraceptive pills. There are injections, there are implants, and there are intrauterine devices. Every contraception method has its own benefits and flaws. So it depends on each patient. So if I have to say this is best, it doesn't work. So if I say a oral contraceptive pill is the best method, then to a person who keeps forgetting it, I can't say that's a method. No. So everything has its benefits and risk involved. Oral contraceptives have, if used correctly, 99.5% success rate. Same type implants are there now, or injections, which again has 99%. But here the periods become irregular. In pills, the periods will be regular. There are intrauterine devices where the periods are regular, but the flow may be little more when it is intrauterine copper-T devices. So there are benefits and risks. So it has to cater to the choice of the patient. So each device or each contraceptive option is offered to the patient, and whichever is best catering to the patient has to be used. Like if a person is very young and not looking for an intrauterine or not delivered, we would offer a pill. But if she has already a liver disease and all, then we may not offer. So it is each tailored to the customized service of the patient.
Makes sense. Now, you spoke about the pill, right? The pill is often, has a lot of myths around it. I feel like, taking contraceptive pills, people talk about weight gains and things like that, having a contraceptive pill. And there is also this talk around how your body will get dependent on it for even your normal regulation, right? What are like, how much of this is true, and what are the actual side effects of taking a pill?
So these are all myths. Over the years of medicine advancement, pill also has advanced, and we have very low dose pills in the market. We have also pills which decrease weight and do not increase weight. Okay, so these things are only myths. See, over this again flows in the years. Our grandmothers had 6, 7, 8, 9 children, and that was the thinking that everybody should have so many children. If you don't have, that is the problem. So there's a question for our exams. Why is Indian population is the maximum? Still, why do you have the most IVF centers in India? That is the problem. When the neighbor has 7 children and you don't have one, then the IVF requirement is more. That is the problem we have in India. So, over the generations, when you have 7, 8 children, and the thinking is like that, that you need to have 7, 8 children, there is no role of contraception. You are making this, you get deliver one in 2 years, you have another, then you have another. So, the body of a woman is just a machine delivering. So that is the concept. So if that concept has to work, then contraceptive concept doesn't work there, right? So that is what flows into the mind, because that is preset. That is preset, and that is what we want from the women. So probably that is how over the years. And then it was high dose pills were used at that point of time, probably. Now there are low dose pills, so actually nothing major. The immediate side effects of a contraceptive pill would be gastritis, headache, vomiting, nausea, all this probably for a month. After that, it settles down. The long term complications are like if you have migraine and you are on real migraine issues with aura and all, then a pill may increase it. Or if you have liver disease, then you'll have to check on how long to take it. If you have epileptic medicines on, then you will have to change the dose. Or if you have breast cancer in your parents very early, then you have to modulate the dose. If you have hypertension, stroke, paralysis, then again, so these are many things which are there. If you have those problems, then the oral contraceptive pills are appropriately modulated, but otherwise they are more or less safe. It depends on how long you want to use it and how do you use it.
So is it safe to like use a oral contraceptive for really long term, for 10 years, 15 years?
Yeah, it is definitely fine. But as I said, liver disease should be ruled out. Hypertension should not be there. And over long years of use of oral contraceptive pills have known to increase the chances of benign, that is non-cancerous breast lump, but not cancer as such.
Okay. Now if we move into fertility, right? What are the like currently you deal with so many patients, right? So what are the three most common tips that you give to patients who are trying to conceive based on today's generation?
Everything boils down to diet, exercise, number one. Number two is early pregnancy. So now, because career choices are variant, you need a lot of education basis for career options. So delivering early, planning pregnancy is becomes a task because, and as you said before, maybe the 70% villages in our country balance 30 city patients, city population. Of the city, 1 or 2% are software, or 3-4%, I don't know the actuals. 4% may be software. Only these softwares plan. Rest do not plan pregnancy. Rest all get pregnant as and when. So the thing is early pregnancy. So the most important thing that I would like to think is plan pregnancy a little earlier. The best age to conceive is 24 to 29, 22 to 29. So the best eggs are at that point of life. So 22 to 29 is the best time to get pregnant. So plan pregnancy early. It is difficult for everybody. So I mean, there's no hard and fast rule. It is all for them to plan because, yeah, girls have to be self-sufficient. They have to be their own earning members. They have to be strong enough to carry on to. But pregnancy planning should be early.
Okay. Do you have cases of unexplained infertility where you've tried everything and it doesn't work out?
Yeah, so 60% of times they are unexplained infertility. So only 30 to 40% are serious problems where you have either some tubal blocks or hormonal issues or PCOS or something. So almost 60% will be unexplained where you do not know why is it that you are not conceiving, some subtle problem or not known problems.
Now, you have been working for almost 2 decades, right? So what are there any latest technologies that you feel have improved either testing or, in terms of improving the fertility or things like that?
um, when you see from infertility point of view, testing, okay, lot of tests are there, lot of methods are there where you can try to improve your fertility rate. There are in medicines, non-hormonal medicines, where you can use it for some time to increase your quality of eggs and all that. So these are all latest forms. But when you actually come to IVF, then there are embryo storing techniques also, which are very good. Egg storing, egg freezing techniques. Now young girls are going into egg freezing when they don't know when they are going to conceive, and so that has become more open and more talkable and more taken up. Even young girls of 22, 23, 24 do come asking of egg freezing and how long they can wait to freeze eggs, and all that is being done.
Got it. Now, of course, we spoke about the general aspects of fertility, right? You said diet, exercise, and probably early. Are there any factors which are often overlooked by most couples for fertility?
Yeah, so see, we usually, when it comes to infertility, we'll see sperms and we'll check the ovum, egg release, follicular scans to see the tubes, the hormones. These are basic infertility problems which we check. But what most of us miss to check is of any substance abuse, which can be one cause of infertility. There can be excessive exercise. So excessive levels of exercise again cause hormonal imbalance and prevent fertility. There can be chemical intake of pesticides, increased pesticide, plastics, heavy metals. There are a lot of diet formulas which are sold in the market which have heavy metals. So heavy metals can be the cause of. Then a lot of heat exposure. This is very specific for today's young generation into software. So the more heat you generate in and around for the male infertility, in and around the penis on the sperm seam area. So you keep, the most important fact here is keeping the laptops on the lap. So when you keep the laptops on lap and work for hours, the laptop is very hot, and the heat jet generates, it decreases the quality and quantity of sperm. So heat exposure, chemical exposure, then substance abuse, excessive exercise can be one of few of the factors which we overlook. We look into endometriosis, infections, a lot of things that we regularly look into. These are the regular organic problems which we look into, but these are subtle problems which may fail to look into.
Okay. Now, considering issues like, say, PCOS, thyroid, diabetes, and all of that, right? How difficult it is for women to conceive with these issues, and what are the steps that you normally advise them to, sort of get into a healthy pregnancy?
See, PCO, you have to treat. There is no other option. If you treat PCO, there are definitely very good results. So treatment of PCO can be lifestyle and can be tablets. So based on the treatment of PCO, you treat them. The second you asked is diabetes and thyroid. Now, but diabetes and thyroid problems definitely cause hormonal imbalances. So when there are hormonal imbalance, conceiving sometimes becomes difficult. Diabetes decreases the sperm quality. So again, conceiving becomes difficult. The ovulation may be impacted by high diabetes and thyroid problems. Thyroid can again cause menstrual irregularities, which can cause. So these are the problems. And diabetes also known to cause erectile dysfunction in men. So these are the problems which can lead to infertility based on diabetes and thyroid.
And how do you help them just by lifestyle correction and basis? For diabetes and thyroid, you give them medication, or how do you?
Diabetes should be corrected. The later you have diabetes in life, it's a silent killer. So the later you have diabetes in life, the better. So lifestyle management starts first, but in case there is diabetes, you need to correct it, because a controlled diabetes can do much better than anybody else.
Got it. Now, when we get into the pregnancy aspect, or when we are planning for pregnancy, right? Are there, again, overlooked factors that you have to tell the patients in terms of preparing themselves for pregnancy?
So the most important factor when you are preparing for a pregnancy is pre-pregnancy folic acid. So pre-pregnancy folic acid, very important, but still I don't think 80% of our population takes pre-pregnancy folic acid. So one of the very important thing is having folic acid before you conceive, at least 1 or 2 months before you conceive should have folic acid. Number one. Number two is look into all the medical conditions that a woman is having, so that pregnancy can be happening easier and without any problems. So like diabetes, hypertension, other lifestyle disorders may affect pregnancy in different manners, and early prevention correction is better than having later problems. Third thing is in the decision making, as you said, start at first stress. Hmm? So find out your stand on your stress. Now, if beyond, since now we are more into nuclear families, and both couples are working, so the amount of time the person has, both the couple has for their future children may not be equal to what the mother used to give before, a generation before. So find out how well you are placed in condition of stress, your work, your decision making capacity, how you are able to manage your stability issues. All this needs to be seen before you conceive. Also, beyond that, your medical aspects.
And when women get into pregnancy, right, we speak about the common pregnancy challenges like nausea and things like that. What are the lesser known pregnancy challenges that are still common?
So, the most important, least known is the mental health problem in pregnancy. Hmm? So, as soon as pregnancy comes in, half of them are not ready for it. So they go through the turmoil of how am I going to manage, this is going to happen, what is the changes happening in the body. So from the beginning, that mental health issue plays a big role on everybody. Now, as we see girls more into career oriented, even our children or even myself, what we my mother never trained me to think about how I will manage the pregnancy, right? But my mother trained me to how to clear the entrance, how to study, how to get good marks, how to fight the race of the work life, everything she taught me. But she never taught me how to manage a child, because they thought that was part of life and it would just happen. So even if you are today the age of the mother during the first pregnancy, maybe older, like they are 30 plus, most of them. So even if the age is more, but the management of a pregnancy and a child is still 22, right? So you are not trained to do what you have been trained to run the rat race, but not the mother's life. So that is one challenge which every girl faces with the pregnancy coming in, that what is going to happen and what is she looking forward to, because she has not done a homework or an entrance exam to get into motherhood. So doesn't know what she's looking for in the next 9 months and beyond. So that is one big challenge, mental health. Second problem is body changes. There are a lot of hormonal and bodily changes that come in with pregnancy. So more sleep issues. You have to swipe in to work at 9 o'clock and you are still sleeping at 8 o'clock. So there are a lot of things which you only don't understand, that body starts changing. So getting acclimatized and accustomed to these changes of your body takes a little time and little toll on everybody. A lot of muscle cramps which come in with pregnancy. So which is just out of the bloom. So we don't think, no, tomorrow I'll be pregnant and I will have muscle cramps. It's just part of that pregnancy comes in, and then there are times when you're not able to handle those muscle cramps, and then it takes a little toll. So these are fewer things which you'd overlook it and you think it's part of everything, and it's just part that every woman can go through it. You don't think that it is not possible to go through it.
That I think, having gone through the journey myself, I think totally resonates with it, right? I think especially after the kid is born, nobody really prepares you for the change, the 360-degree shift in your life. Now, having said that, right, there are a lot of misconceptions that float around about pregnancy and childbirth, right? What are the most common ones that you come across?
So most common ones are you can't go out on an eclipse day. You can't eat certain things in pregnancy. You can't sit down. First 3 months of pregnancy, you can't walk out of the house. Okay, so there are a lot of things. It is diet. So there are a lot of things concerning to diet, exercise. So pregnancy is a normal physiological condition. What I tell my patients, what you have been doing before pregnancy, continue to do after pregnancy. You do not have to eat for 2%, you just have to eat for 1%. My weight is not gaining, my weight is not gaining. Your weight is not related to baby weight. So you don't have to get 20 kg to show that you are pregnant and your baby will be fine. Nothing. You have to maintain your weight. So because it's later difficult to lose. So maintaining weight and misconception about weight, misconception out about certain food habits. I can't eat papaya. I can't eat non-veg in first 3 months. You need high protein. Body is changing. So these are the all the myths around diet, exercise, and the uh, certain environmental factors which say that you can't do this, you can't do that. It is all a norm unless you have a complicated pregnancy.
Okay, so typically just keep doing what you were doing before and probably just look at your diet and things like that for the kid. Now, IVF has become very, very common, like you also mentioned, right? What is the actual success rate of IVF that you have seen in your experience?
IVF, actual success rate of IVF is 30 to 40%. Okay. But because at times the numbers may be more or less, it may show 50-60% at some places and all that. But ideal success rate is 30 to 40% of, and it usually depends on the quality of the eggs, the age of the patient, and overall other medical problems.
What are the most important factors contributing to the success of an IVF procedure?
The most important is age. The lesser the age, the better. The quality of eggs. Now, quality of eggs also is age based most of the time. So, a good, better quality of eggs will give a better embryo and success rate. Embryo quality. So, once the egg meets the sperm and the embryo, there are different qualities of embryo that is formed. So, a better quality embryo will have more chances of sticking on to and going into a pregnancy. Then, the uterine receptivity, how the uterus lining is and how the uterus is receptive to take in the pregnancy which is coming. Then the medical condition, associated endometriosis, associated adenomyosis, how which it will help, recurrent pregnancy loss histories. Then expertise in IVF practices. So the expertise becomes one of the major role, key role in the success rate, and the protocols that they are using. So various protocols, it depends on how you manage them.
When somebody goes for IVF, right, what are the actual questions that they should be asking their doctors?
So how long the process is, and how it is going to mentally affect me, because not, as I said, 30 to 40% success rate, so others fail. So there are people who are going through multiple cycles of IVF. So when is it, how long I can do it, what is the best thing, how far I should look onto, what is the cost involved in all this, and what is the toll it is going to take on my mental health and also on my relationship, because uh, failures take a toll on the relationships.
Typically, how long does it take for the entire IVF process?
So with a good egg and good uterine receptivity, 1 month only. But now most of them will make an embryo, take all the eggs out and make embryo 1 month and make the uterus receptive in the second month. So ideally in 2 months also. Then the embryos are already stored. Repeat sittings is only 1 month each.
And what are the most important risks and side effects of IVF?
Risk of side effects, now these are IVF is basically giving in lot of injections to form lot of eggs. So when we do fertility treatment with tablets, it is just increasing the egg size to little more and egg number by 1 or 2. Okay, but when we do IVF, we need a whole lot of eggs. The more the eggs, the more the merrier. So you indulge in giving injections so that you can't keep doing it every month, no? So you need it out at one sitting. So then lot of injections, lot of hormonal changes, mood changes, bloating, cramps, hair loss. So these are the small problems, and anxiety, stress. This is where actually the stress comes in, because then you don't know what is going to happen. With one pregnancy kit test, the entire month or 2 months effort and money is going to be positive or negative. So increase very high stress levels, lot of bone aches and pains, and anxiety.
Now, in terms of reproduction these days, right? A lot of new parents are being told to store stem cells, right? Can you explain that a bit? Like, how does it help? Is it required? How does it work? And things like that.
The process of collecting, processing, and cryopreservation of stem cells from various sources, mostly from the umbilical cord, and for the potential use in future. This is what is stem cell storage.
Can you
Now,
also explain like what is stem cell for somebody who's watching who doesn't understand exactly?
so when a sperm and a ovum meets, egg meet, they form two cells, and then the two divides into four, four divides into eight, eight divides. So till a certain stage of cells, they are just a ball of cells. After that, each cell gets form different parts of the body, different organs, different systems, digestive, all this. So these cells are called stem cells. They are totipotent cells. They have the potency to convert to anything. So there are studies going on since many years, more than 50 years around, on stem cells, to how to make use of this totipotent cells in various treatment options. So these cells are called stem cells. Once the baby is Before the baby is born, as soon as the blood going across the body is contains more of stem cells. But by the time you grow and become adult, 19 more than 99% is adult cells. So, if I need to take stem cells from my blood, I can't take out the blood and like we do blood transfusion, we can't take blood out from our arteries and then make stem cells. No, we can't. So, they are the newly generating cells. You can get them from the bone marrow. So, you get it even today. If I need to take out stem cells, I can puncture my bone marrow and take out the stem cells. That is the way many people used to use it for treatment. The other method is by storage. Storage can be public banking or private banking. So when the baby is born, after the cord is clamped, the blood is taken out from the placental tissues from the cord, and there are certain private banks which process it and cryopreserve the stem cells only. So if you give almost 100 200 ml of blood, you may get 20 30 ml of stem cells. So they cryopreserve this stem cell for many years to be used in case required for various diseases. So lot of solid tumors and blood disorders like sickle cell disease, like thalassemias. These all stem cells can be used. Recently, liver transplant, corneal transplant also has been used. So stem cell usage is very many, but not completely there. But over last 25 years, stem cell has been used for leukemias and cancer treatments and all that. So these are the things, stem cell treatment. So it's like storing your stem cells to be used for the future. The use comes very rarely, but that is a mode of use of storing the stem cells for your future use in case required.
Would you recommend it to every parent to be?
There is no, it is to be offered to every parent, and it is a parent's choice. So there is cost involved. There are certain conditions which are running in the family. In such cases, you can store it. Whether it is good to be stored by everybody or not, that is still to be studied and not in the right state to be addressed right now. It is by choice right now, offered to patients and by choice.
Okay. Now, you also mentioned a lot of women now are opting for egg freezing, right? What is the guarantee with egg freezing for future sort of fertility?
Guarantee with egg freezing. So once you freeze the egg, they get freeze like it is. So there is no change in it most of the times, but there is no guarantee. It is It has to, the egg freezing means just freezing the egg. So if a 22-year-old girl freezes the egg, the quality of the egg 10 years later will be of a 22-year-old girl. That's all about egg freezing. Now, success rate of IVF doesn't depend on egg freezing. There are many other things where on which IVF success rate depends. So it is the same thing which happens. So it's not a guarantee that you will have, but it is just to freeze the egg so that you can use it later when you are older.
Are there any top 3 or 4 considerations that you feel that a woman or a couple deciding on egg freezing should be looking at?
So basically, it's the age related. So you want to freeze your when a girl is born, the eggs are born with the girl. Okay, over the years they also grow and get released. That's all. So the age of the egg is as older as the girl is. So you think about egg freezing only when you want to have a pregnancy at a later date. And then you freeze the egg. So age become one of the consideration. Second will be finances. It's not easy to just store the feed. You can't store like you store chicken eggs. No, you need specific conditions for that. So finances and cost becomes a major part of it. And the third consideration will be definitely emotional and psychological thinking and ways how do you manage it. If I tell my mother that to that generation that my daughter at 24 wants to store the egg, my mother will think she's mad, right? So it's a lot of psychological and emotional thing that plays at what you. So these are the three considerations.
Is there any age before which you recommend freezing eggs, or you think it's fine at any time for them to do it?
No, 20s to early 30s is the time when you need to, 20s to early 30s is the time when you need to store the eggs. After 35, if you store, there is, anyway, the eggs are old, no? So the success rate equally falls down because it depends on the success rate. The younger the eggs, the better it is.
Other than age, are there any other factors that influence using a frozen egg later?
No, mostly age. Once you freeze the egg, as I told you, it remains of that age till you are using it.
Are there any side effects of egg freezing other than, like you said, the mental or social impact of it? Are there any side effects on the body or anything like that?
So at a younger age, you would be given so many hormones to pump in lot of eggs so that you get a lot of eggs and you store it because you don't know no, which are good quality and not good quality. So you need a good amount of 18, 20 eggs to store it. So you will be pumped in with lot of hormones for that month. So lot of cramps, bloating, then that hormonal changes, hair loss, anxiety, all this again becomes part at a lower age when you are not looking forward to anything. You're just trying to store the eggs. That's all. So at that point, all these side effects will be there.
But in the long term, nothing. It's just a temporary.
Yeah, it's a temporary at that point, but any hormones taken at any point unnecessarily is not advised. No, so that is it. But see, it's like at the success rate of an IVF of an egg which is 35-year old plus, maybe just 50%. I mean, the egg freezing egg will work at 50 to 70% times. 30 to 40% times. But if you have freezed it, it may work 70 to 80% time. Understood, no? So that is why egg freezing is better.
And does egg freezing also take the same amount of time like IVF?
No, yeah, it will take not like IVF. IVF is two parts. One is take out the egg, make the embryos, and then the second part is put the embryos. The put one is not happening. It's only releasing the embryo, eggs, and storing it.
So around a month,
Yeah,
they
yeah, yeah.
inject you.
15 days probably.
Typically, how is the cost? Like, is it every month you have to pay, or do you know anything around like how is the cost generally structured for egg freezing?
I think now they store for 10 years, but I don't know about different centers how it is. Cost may also vary from 20, 30,000 per year to maybe 1 or 2 lakhs. Depends on centers I have. That is. not accurate.
Okay, so if anybody is looking to do an egg freeze, or if is they're confused about whether they should freeze an egg or not, what are the key things you would advise them?
Definitely to meet a fertility specialist, because at that point of time the girl has lot of questions to be answered. So definitely meet a fertility specialist and your gynecologist, and together make a choice, a fair choice, decide on what you want to do.
Okay, now if I just speak about your delivery portion of it, right? You have natural and you have C-sec and things like that. Is there really a difference between a kid born in natural and cesarean? Also, is there really a difference in the mother's body in both of those kind of deliveries?
See, both are different methods of delivering, so both has its benefits and risk. In a vagina, so before I tell you the benefits and thing of vaginal versus C-section, see the end result, the mother should be good and the baby should be good. This is the end result of it. You do not see whether it is vaginal or C-section delivery. So as again in your grandmother's time, the C-section scars would be vertical scars. So when it was vertical scars, it was difficult to heal and difficult to go on in life for some time. But now with transverse scars and more easier techniques of operating and recovering, C-section has become equally same like a vaginal delivery, though they are different methods. You can't call them same. So with a vaginal delivery, basically, if you see from a layman's point of view, you suffer pain for one day, deliver, and that's it. If it's a C-section, you without pain deliver and have pain the next day to get around. So that is how it is. Now, C-section delivery, you are operating surgery, more blood loss, and definitely it is touching the other organs. So there are risks to other organ injury, all that. So these are the things. To vaginal delivery, the problems may be pain, severe pain, aches, weakening of the body, the pain that the woman has to go through, expelling the weakness of the pubic muscles and ligaments. So these are causing incontinence problems later. So these are parts and thing. Then to baby, if the baby comes out, so baby is destined like that, so made like that, so it goes through the vaginal and bones, pubic bones of the baby. It crumbles the body of the baby, squeezes so that baby comes out and cries well. So that is a technique. It can go wrong at any point of time. It cannot work out as it may take longer time. So if it comes out, everything goes well with vaginal delivery, that is the best. But if it doesn't go well and we need other method to protect the mother or at the best interest of the baby, then C-section is best. So it depends on what is best at that point of time for that person.
So if somebody is choosing C-section, is that recommended according to you, or if you are healthy and everything is fine, you would recommend a vaginal delivery? Because there are a lot people nowadays who also choose for C-section.
If you are fine and good, then it is better to go ahead with vaginal deliveries. But there are so many patients. Um, at so as I told you before, also see today birthing is a big task. It is easier to work in an office rather than giving birth. Okay, so that is the condition we are reached at now. So a person who is 9 month anxious and crying that she will have to go through vaginal delivery, I don't think that is worth it to give her and make her struggle to go through a vaginal delivery. No, no, you have to do it, and C-section is bad. Anything like that, that is not implicated. It is explain the patient, it is at the best interest of the patient choice, whatever she wants to go through. If there are anything which concerns and against vaginal delivery, she should go in for a C-section. Otherwise, it's at the best interest and the patient choice what is better.
Okay. Now, postpartum, right? Are there any significant physical or emotional hormonal shifts that you have noticed people underestimate?
Everything changes postpartum. So now we have all glamorous mother and baby birthing units across India. So almost everybody concentrates on the birthing units where mother is given the preference. So with the glamorous 9 months of pregnancy, the mother is not taught that after delivery it's not going to be so glamorous. Okay. And after delivery, it's going to be difficult with lack of sleep, aches and pains, swelling coming up in the body within for almost 2 weeks, with baby blues coming in, with you being locked up in the room with the baby full time. And so there are many things which come in from physical problems to hormonal problems to mental shifts. So all this takes a big toll unless the lady is prepared for it. Most of them are not prepared for it. And what comes in is a big surprise to them. And then it takes a good amount of toll on every woman.
And are there actually any long-term physical changes that happen postpartum?
Yeah. So the physical changes which can happen is weight management becomes difficult. Mm. You have a lot of loose skin around. So to get back to the same tone may be difficult. The breast size becomes bigger. So that becomes a problem. There are stretch marks across which may not go, more half of them may not go. And then there's something called diastasis recti, where the muscles are separated in the abdomen, upper abdomen. And so it falls more than the stiffness of the abdomen is lost. Then there are more widening of the hips. So there are a lot of physical problems that can come in. There is hormonal things like the hair growth may come down. There may be mood changes which comes in, which is permanent because the child is permanent, right? Then there are mental shifts from baby blues to anxiety to depression to psychosis. So these are the problems which may stay in for a longer time.
Now, after pregnancy, right? Going back to your relationship, intimacy, and things like that, right? Medically, I believe after 6 months, it is advised that you are free to have sex or be intimate with your partner. But is that really realistic for most women? And what do you think is like a realistic time that you generally see women are more comfortable?
So it's not 6 months, it is 6 weeks. So for a vaginal
Sorry, I
delivery,
meant 6 weeks. Yeah, yeah, correct. Yeah.
so vaginal delivery is 6 weeks and a C-section is 8 weeks. So it is like up to this time, you should not. It is not that you are ready for it at any point. It is basically the readiness of the woman. Hmm? So it is not only having sex does not implicate just penetration, right? So penetration can happen after 6 weeks in a vaginal delivery and 8 weeks in a C-section without causing any problem to the uterus or the body of the woman. But having sex is is at the choice of the woman because it's not alone penetration. She is going through her body changes, her aches and pains, her sleepless nights, breastfeeding. So there are many things which may take a little time there are many people who come off it very fast. There are many people who take lot of time. There are some patients who will say, doctor, I took 1 year to get out of my postpartum problems. There are patients whom I will see at 2 weeks and I will see she's ready for a disco. So it all depends on how you have taken the thing and how well your body is recouping and how well you are nourishing your body, nourishing mentally, emotionally, physically, everywhere. So how you are nourishing and how quick your body tosses back to normal. So ideally it is 6 weeks and 8 weeks. You should give time. Beyond that, it is the choice of the patient.
Around postpartum, right? What are the most common misconceptions you have seen?
Again, here the most common misconception is that the anxiety and baby blues and all this depression which comes in postpartum is just hormonal and it goes away. No, it's not hormonal alone. It is the part of the environment which is causing. So last time I had a patient delivered, she comes back in 5 days. She is crying her life out of it. Her and her mother is there with her. Her husband is there, and the mother is like, what is there? I delivered three, four children. Nothing happened like this. Why you are crying like this for no reason? I mean, the own mother is not able to understand that this is not hormonal. And for her daughter, it is difficult to go through those blues. So basically, the main misconception is no, it is you need to help. You need to help every woman who has these postpartum blues, every partner after so postpartum blues needs to be handled and taken care of. Second thing, most common thing I have seen in our setups are once you deliver, the husband is out of the room and the mother is inside the room. No, the husband is not going to kill. There are husbands which are different. Okay, that is different story at all. But now most of the husbands are helping the woman. So if you're helping, let that woman be with her husband, not the mother. Okay, mother can come in and take care of it whenever required, if at all is required. But husband is the one who has to be. So as soon as you deliver, you are locked in one room with the baby, and the mother comes in and gives boiled vegetables and not able. This is not a concept. Once you are delivered, you are open, you are fine, you are delivered. Your body needs time to recover. You need lot of love and attention. You need little pampering. All this at times the mother may do, at times the husband may do. So do not keep the husband ever just thinking of the concept that no, husband may come in and have sex. So this will not is going to be the concept. The concept is she needs lot of support, both morally, mentally, psychologically, and this support comes in through the husband who's been with her all through. So this concept of as soon as the baby delivered, go to mother's house or deliver the mother baby in mother's house. The husband has no stand. Hmm? But that is not correct. Today's women needs husband at every stride. Mothers are not the servants. They are just help. They are support. That's all. So I think every woman postpartum, they should have a class before they deliver. That postpartum is not going to be easy, so it's not a bed of roses. That being a mother is not so that I am become a mother. The glamorous suddenly stops. So tell them that these are the things which you are looking for, and these are the things what need to be there, and these are the support groups. Now we have lot of support groups. The mothers, there are in the hospitals and beyond the hospital, postpartum support groups are there. All the mothers will be together. They'll be discussing this. So lot of help from support groups, lot of help from spouses. So these are things which are mandatory now at the postpartum period.
Another concept that I want to touch upon is there is this common myth that you cannot get pregnant while breastfeeding. Is that true?
So breastfeeding is a method of contraception. Okay? So when you are breastfeeding, uh, because of the change in hormonal levels, there is definite contraception, but I think around 90-94% thing. But the chances of getting, so compared to a pill has 99.5 and a breastfeeding is 90 to 94%. So it does help in contraception. It's not foolproof, but yeah, it does help in contraception, breastfeeding.
Okay, I think I just want to do some true or false, and you can just explain it towards the end. Now that we are nearing the end, right? Um, One common myth that you briefly touched upon is eat for two if you're pregnant. Is that true or false?
No, no.
Eat
False.
false. Okay.
Eat for one.
IVF babies are weaker or less healthy than naturally conceived babies.
False.
A woman should not eat papaya during pregnancy.
Papaya is one of the king of fruits, and the ripe papaya is one of the best fruits in pregnancy.
Okay. Drinking ghee or saffron milk helps with normal delivery.
Nothing like that. If that was the concept, we would have 100% normal deliveries, no? Vaginal deliveries. So that is not a concept.
If you have had one C-section, you can't have a vaginal delivery after that.
False. You have 70% chance of VBAC, that is vaginal birth after C-section. But it also depends on what was the cause of the C-section in the previous pregnancy. And there are many factors to it and many risk factors to it. So everything is appropriately seen and then balanced.
Sex during pregnancy is unsafe.
No relation. You can have sex as if there is no pregnancy complication like low-lying placenta, placenta previa, or bleeding in pregnancies, then sex is not a problem in pregnancy.
PCOS is always linked to weight gain.
Most of the time, PCO and weight gain is interrelated. You gain weight, PCO increases. You increase PCO, weight gain increases. So almost most of the time it is in there. There are thin PCOs, then but the thin PCOs are more difficult to treat because a fat PCO, a more weight PCO, you lose the weight, half the PCO is gone. But in a thin PCO, where is there to lose weight? So you need hormonal treatment for that.
Postpartum depression begins immediately after birth.
The first 2 weeks is baby blues, postpartum blues. Most of the time, this more of the little bit of environmental, the change in the hormones, and all this gives to baby blues. In 2 weeks, most of the times the baby blues goes away. And what comes beyond that is what is postpartum depression.
A regular menstrual cycle means you're definitely fertile.
No, a regular menstrual cycle doesn't mean you are ovulating. So it's not necessary.
You should not exercise or walk during pregnancy.
You should do every exercise which you were doing, swimming being the best exercise. So you should continue to do exercise. It gives you a happier pregnancy, a healthier baby, and a easier delivery.
I think that's all, Dr. Teena. Any final words or insights to the audience in terms of navigating their reproductive health?
Pregnancy is a time when you have a life inside you. And this is the most beautiful thing on earth, where you carry something beating and moving inside your body, which can never happen otherwise. So feel on top of the world when you are pregnant, because that time is difficult to get back later. And take help. There are many people, including your spouse, relatives, friends. Pick and choose people who are there to help you at every point of time. Help is there. Don't think at any point of time, not only for reproduction, for all part of your life, you are alone. You just have to call, see and touch somebody to help you, the right person, and that he or she is always there to help you. So do not take decisions alone at certain points of time, and look for support always.
Thank you so much, Doctor. It was a wonderful session to have you. I think I learned a lot, and I'm sure everybody who's listening would have learned a lot. Thank you so much for your time, and really great to have you here.
Thank you. Thank you very much.